Hello YouTube, we are back with another exciting video topic. Today's topic was inspired by my close family friend, Adena. Thank you, Adena, for taking time to hear out my ideas and provide ongoing inspiration with the channel. Welcome to the Rapid Nurse channel. Who am I? I'm just a nurse with years of experience, making me a nurse of all trades, but a master of nothing. These rapid experiences in the healthcare field took a young, fresh-faced nurse with boundless hopes for our healthcare and twisted it into a tired old nurse with a jaded sense of humor. On the channel, we will discuss topics that affect our healthcare. For most of history, medicine was based more on tradition than on science. Doctors believed that illness resulted from an imbalance of fluids or bad spirits. Many common practices, such as bleeding patients, using live animals, or cutting into the brain, were performed without a complete understanding of how the body worked. Some of these methods had minor benefits, others caused significant harm, while a few still persist in limited forms today. In this video, we'll explore the strange history of old medicine, from the reasoning behind these treatments to their real impact on people's lives. Before we start up the video, please take a moment to hear from our friends at Fiverr. I've been searching for a way to boost my YouTube presence, and I think I've found the perfect solution. Fiverr. It's my one-stop shop for all my freelance needs.
Tired of juggling multiple freelancers and sites? Want to streamline your business and save time? Fiverr is the answer.
I've already hired a graphic designer to create a new logo and a social media manager to handle my content. And guess what? I found them all on Fiverr. CT match for any project, big or small. Becky.
With Fiverr's vast network of talented freelancers, you can find the perfect match for any project, big or small.
The platform is so easy to use. I simply posted my project, set my budget, and received dozens of proposals within hours. It's incredible. Here at Rapid Nurse, we work with the talented freelancers of Fiverr to create this very YouTube video you are watching.
Join the millions of satisfied customers like Rapid Nurse who have discovered the power of Fiverr. Start your next project today and see the difference by clicking on the link below to help the Rapid Nurse channel.
So what are you waiting for? Visit Fiverr today and start collaborating with amazing freelancers from around the world.
Fiverr, your freelance marketplace, your business success. Now back to your video.
Bloodletting is one of the oldest known medical treatments in human history. It was practiced for over 2,000 years by different civilizations, including the Egyptians, Greeks, Chinese, and Europeans. The basic belief behind it was that the human body contained 4 essential fluids, or humors: blood, phlegm, black bile, and yellow bile. According to the ancient theory of humoralism, disease occurred when these humors were out of balance, and the most common culprit was thought to be an excess of blood. So, to restore balance and health, doctors would physically remove blood from the patient's body. It sounds extreme today, but at the time, it was not only considered logical, it was completely standard medical practice supported by respected physicians like Hippocrates and Galen. Galen's writings on bloodletting influenced European medicine for more than 2,300 years. The actual procedure of bloodletting varied depending on the patient's condition and the area of the body that was believed to be affected. Physicians would open a vein, often in the arm or neck, with a scalpel or special lancet and allow blood to drain into a bowl. In other cases, they used heated glass cups to create suction or applied leeches to draw blood more gradually. The belief was that removing the bad or excess blood would rid the body of illness, clear the mind, and restore vitality. Bloodletting was prescribed for almost everything: fevers, headaches, pneumonia, strokes, broken bones, inflammation, and even mental disorders. It was also used as a preventive measure. People in good health would regularly have blood drawn to avoid disease altogether. In medieval Europe, barbers often performed bloodletting alongside their usual grooming services. That red and white spiral pole you still see outside barbershops today symbolizes this practice. The red represents blood, the white stands for bandages, and the pole itself is based on the wooden stick patients would grip tightly during the procedure. Though barbers had no medical training, they were considered skilled enough to handle minor surgeries, dental work, and of course, bleeding patients. Despite being widely used, bloodletting had serious risks. Removing too much blood could lead to extreme weakness, dizziness, shock, and even death. The tools were rarely sterile and infection was common. Doctors often disagreed on how much blood should be taken, how often, and from which part of the body. Unfortunately, this lack of consistency led to many preventable deaths. One of the most famous examples is George Washington, the first president of the United States. In 1799, after developing a throat infection, his doctors attempted to cure him by performing multiple bloodlettings over a single day. They ended up removing an estimated 40% of his total blood volume. Instead of recovering, Washington's condition worsened rapidly, and he died later that night. Today, many medical historians believe the treatment played a major role in his death. Bloodletting finally began to fall out of favor in the 19th century, as scientific research and clinical studies started to prove it was ineffective and often harmful for most illnesses. The discovery of germs, a better understanding of the circulatory system, and the rise of modern medicine all contributed to the decline of this ancient practice. Still, it wasn't completely abandoned overnight. Some doctors continued to use it well into the 20th century for select conditions like high blood pressure or certain blood disorders. Even today, a modern form of controlled blood removal, called therapeutic phlebotomy, is used in very specific cases, such as hemochromatosis, a condition where the body absorbs too much iron. But these treatments are based on evidence and performed under strict medical guidelines, unlike the guesswork of historical bloodletting. While bloodletting was once the go-to remedy for nearly every ailment, its decline marked a turning point in the evolution of medicine from ritual and tradition to research and evidence. As bloodletting began to lose its place in mainstream medicine, another method of removing blood, but in a more natural way, took its place in popularity. This brings us to leech therapy, a treatment that was both ancient and surprisingly long-lasting in the world of medicine. Leech therapy, also known as hirudotherapy, may sound outdated or even disgusting today, but for centuries it was considered a serious and sophisticated medical technique used across ancient and modern civilizations, all based on the same idea behind bloodletting, that many illnesses were caused by an imbalance of the body's fluids, especially having too much blood. Instead of cutting open veins with knives or lancets, doctors turned to a more natural and less invasive tool, the leech. Medicinal leeches, specifically the species Hirudo medicinalis, became extremely popular in Europe during the 18th and 19th centuries. And in France alone, it's estimated that over 40 million leeches were imported annually to meet the medical demand, with hospitals and private doctors stocking them like essential tools of the trade. These leeches were applied directly to the skin, often around the temples, arms, or lower back, and allowed to attach themselves and feed for about 20 to 60 minutes, during which they would draw several milliliters of blood, while releasing their saliva into the wound, a saliva that contained over 100 biologically active compounds, the most famous being hirudin, a powerful anticoagulant that prevents blood from clotting and improves circulation around the wound site. While the logic behind leech therapy in the past was still rooted in humoral theory, aiming to rebalance the body by reducing excess blood, some of the effects it produced, particularly in localized swelling or congested tissue, led to temporary relief in patients, which only strengthened its reputation as an effective treatment. Leeches were prescribed for everything from fevers and headaches to more severe conditions like inflammation, menstrual disorders, high blood pressure, eye diseases, and even hemorrhoids, though the understanding of why they might help was completely speculative. Physicians in the 19th century often used leeches as a gentler alternative to direct bloodletting with blades, especially for women and children. And in some regions, leech therapy was so common that entire economies developed around breeding, trading, and applying leeches for medical care. Despite how bizarre it might sound, modern science has found some valid uses for leeches in very specific and controlled scenarios. In reconstructive and plastic surgery, for example, leeches are used to help re-establish blood circulation in tissue that's been surgically reattached or transplanted, such as in finger reattachments or skin grafts. When small veins in the tissue cannot carry away blood properly after surgery, it can lead to dangerous congestion and tissue death. Leeches can provide temporary drainage while new veins form, essentially acting as biological blood thinners and preventing clots from forming in delicate areas. Their natural anticoagulant properties, combined with the gentle blood-sucking action, make them surprisingly effective in postoperative care. This modern use of leeches, however, is backed by scientific research, regulated by strict medical protocols, and conducted under sterile conditions, which is a major contrast to how they were used historically. That said, in the 1800s, many doctors and patients still believed in their universal power, often applying them in large numbers or in places where no real benefit could be found, such as on the spine, stomach, or genital regions, hoping they would suck out whatever bad substance was causing the symptoms. In some cases, overuse of leech therapy led to severe anemia or infection, especially when sanitation was poor or when leeches were reused across different patients. It wasn't until the rise of germ theory, better diagnostic methods, and advancements in medical training that the use of leeches began to fade, although they never disappeared completely. Leech therapy is a rare example of an ancient treatment that, despite being misused for centuries, ended up having real medical value once modern science was able to isolate and understand the biological compounds involved. But while leeches survived the shift into evidence-based medicine in a limited form, many other treatments from history were not so lucky. One of the most disturbing examples of outdated medicine comes not from the ancient world, but from the modern 20th century, when doctors believed they could cure mental illness by destroying parts of the brain. This leads us to the story of lobotomy. Lobotomy was once seen as a cutting-edge miracle cure for mental illness, a revolutionary breakthrough that promised peace to patients and relief to their families. But behind its early praise was a deeply flawed, dangerous, and often devastating procedure that damaged countless lives. The basic idea of a lobotomy was simple. If certain behaviors or emotions were coming from parts of the brain, maybe cutting or damaging those parts could fix the problem. In the 1930s, Portuguese neurologist Antonio Egas Moniz developed the original form of the lobotomy, which involved drilling holes into the skull and injecting pure alcohol to destroy the connections in the frontal lobe, the part of the brain associated with personality, decision-making, and emotions. Moniz believed that by severing these nerve pathways, a person suffering from severe depression, anxiety, or schizophrenia could find relief from overwhelming thoughts or compulsions. Despite the procedure's crude nature and unclear success rates, Moniz won the Nobel Prize in 1949, a decision that still stirs controversy to this day. In the United States, lobotomy took off in the 1940s and 50s thanks to Dr. Walter Freeman, a neurologist with no surgical training who adapted Moniz's work into a faster, cheaper, and more extreme version called the transorbital lobotomy. Freeman's method involved sliding a long metal pick, similar to an ice pick, through the patient's eye socket and tapping it with a hammer to reach the brain, then moving it back and forth to sever the connections in the frontal lobe. The entire procedure could be done in less than 10 minutes and, shockingly, was sometimes performed outside of hospitals. Freeman even did live demonstrations and drove around the country in a van he called the lobotomobile. He performed around 3,500 lobotomies himself, including on children as young as 12, and claimed to have cured everything from mood disorders to chronic pain and unruly behavior. At the time, many hospitals were overwhelmed with patients suffering from mental illness, and treatments like electroshock therapy, insulin comas, or isolation weren't always effective. Lobotomy was seen as a quick fix, and in many cases, it did make patients quieter and more manageable. But that came at a high cost. While a small number of patients did show some improvement in mood or agitation, most were left with long-term side effects such as personality changes, emotional numbness, inability to concentrate, incontinence, or loss of motor control. Some became completely passive, unable to function normally, while others experienced permanent damage or died from complications. One of the most tragic cases was Rosemary Kennedy, sister of President John F. Kennedy, who underwent a lobotomy at age 23 and was left with severe intellectual and physical disabilities for the rest of her life. Her story, once kept secret, became a chilling example of how lobotomy was used to control behavior rather than treat illness. As the medical community gained a better understanding of the brain and new treatments like antipsychotic medications were developed in the late 1950s and 60s, lobotomy quickly fell out of favor. Studies showed that the procedure's benefits were minimal at best, and the harm it caused often far outweighed any temporary relief. In 1967, Walter Freeman performed his last lobotomy after a patient died of a brain hemorrhage. And since then, lobotomy has been widely condemned as a dark chapter in psychiatric medicine. Medicine has always tried to evolve with the tools and knowledge it had. But history is full of examples where the cure was worse than the disease. From draining blood and feeding leeches to destroying brain tissue, old medicine was often more guesswork than science. And while modern treatments still have risks, we've thankfully moved away from the most extreme and brutal methods. But the legacy of these historical practices continues to influence how we approach healthcare, ethics, and the treatment of the human mind and body today. Which old medical treatment shocked you the most? And do you think there's something we do today that future generations will find just as disturbing? Let us know in the comments below. If you found this video interesting, don't forget to give it a thumbs up, subscribe to our channel for more thought-provoking content, and hit that notification bell so you never miss an update. Thanks for watching, and we'll see you in the next video. I find it interesting as time goes on and as healthcare rapidly changes in 2025, you took the time to view the video. You have my sincere gratitude, thank you. Before I sign out, could I ask you to please like, comment, turn on notifications, and subscribe to Rapid Nurse. This will really help the channel get out of the care of Dolores Claiborne and back out on the front lines of healthcare. Until the next Rapid Nurse video, take care of yourselves and each other.